Hello, Partnering for Vaccine Equity learning community members and others working on vaccine equity, and welcome to today's learning event, Partnering with Local Health Departments. I'm Leandra Lacey, and I serve as a Training and Technical Assistant Specialist with the Urban Institute. On behalf of our team at Urban, thanks for joining us today. Today, we'll hear our speakers outline the role that local health departments play in public health, and especially in immunization. We will also highlight successful local health department and community-based organization partnerships. Before we go further, I'm going to do a very brief review of how the event works. We've all been muted upon entry to this session. You can request to be unmuted if you'd like to speak a question during the Q&A session at the end, and you should use the raise hand feature to do that. You can also type a question for the speakers into the Q&A tab at any point during the session, and we'll get to as many of these as we can at the end of the presentations. The chat room feature is also open today, but if you have a question for the speakers, please put it in the Q&A so we are sure to see it. We might miss it if you put it in the chat. We offer live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. Finally, we will post the slides and a recording of this event available to the learning community and to attendees. Our inbox, vaxequitylearning@urban.org, can always be used to contact us if you have technical difficulties during the session. And now it's my pleasure to introduce our great lineup of speakers today. Victoria Thompson is a program analyst on the immunization team at the National Association of County and City Health Officials, or NACCHO. Within this role, she supports the development and implementation of programs and services for local public health. Victoria received her BS and MPH from George Mason University and recently became a certified health education specialist. Overall, she is passionate about engaging in work that uplifts and serves communities by addressing factors that increase their opportunity to attain their highest level of health. Also from NACCHO, we have Katie Waters. Katie currently serves as acting director of the immunization team. Within this role, she oversees daily programs and services across the immunization portfolio for local public health. With an NPH in health systems, management and policy and global health, Katie is passionate about leveraging vaccines to promote health equity, advance strategic partnerships, and also enhance access to primary care services. We will then hear from Lily M. Hall with the South Carolina Department of Health and Environmental Control Upstate Public Health Region. Lily is currently the Community Systems Director and has been with the agency for almost 23 years. She is a Master Certified Health Education Specialist and a Certified Public Manager. She is responsible for community engagement, development, and partnerships in 11 counties across upstate South Carolina. As the region demobilizes out of the COVID-19 emergency, Lily continues to lead a robust outreach team of health educators and community health workers that coordinate community pop-up sites and COVID education for testing and vaccinations. She has a Bachelor of Science in Health Science, a Master in Health Science, and a Master in Public Health. She is currently pursuing her PhD in Public Health and deemed to finish this year. Lastly, we'll hear from Jenna O, Senior Program Coordinator for the Public Health Division of Washington County, Oregon. In this role, she works to strengthen connections between community-based organizations, the county, and other county partners to work together for health equity. She has 12 years of experience in program development, implementation, and evaluation focused on health equity and community partnerships. Her work draws from her experience as an immigrant, community work with people living with disabilities, and her master's level training in social work and public health. Thanks to all of you for being with us today. I'll now pass it over to Katie and Victoria now.
Yes, hi everyone and good afternoon. As Leandra said, my name is Katie Waters and I currently serve as the Acting Director of the Immunization Program at the National Association of County and City Health Officials, what we call NACCHO for short. So we're very excited to be here today with all of you, especially along with my colleague Victoria Thompson, and we'll discuss the important role that local health departments serve in their communities and how they work with community-based organizations to improve vaccine equity. We really appreciate the opportunity to talk here today. First, I'll start with a bit more about what NACCHO does, and then later we'll hear from two of the wonderful health departments that we get to work with. So next slide. All right. To start, again, I'll give a little bit of background on NACCHO as an organization. So NACCHO is a nonprofit that serves nearly 3,000 local health departments across the United States. We are a leader in partner, catalyst, and voice of nearly 3,000 health departments across the country and advance the work of local governmental public health agencies and their staffs to create healthy, thriving communities. Our work, as you can see on this slide, really spans from advocacy to providing essential technical assistance through the development of timely tools, resources, and publications to move local public health forward. And as was especially true over the past 2 years, we continue to also assess what is happening at the local level and adapt to meet the needs of local health departments. Next slide. So now I'll talk a bit more about the specific role that immunization programs play within local health departments. Next slide. So as you can see here, local health departments really serve in a unique role in that they are really the chief health strategists of their communities. You can see the really interconnected nature of our public health system, which is true at all levels, nationally, at the state level, and locally as well. So in the middle, you can see the public health agency really serving as the connection point across the various stakeholders, including healthcare, government agencies, and community-based organizations. We know that no one organization can meet all of the health needs of a community on their own, so partnerships are essential to our public health system. This is really especially true at the local level, as every community is really unique and has unique experiences and circumstances, opportunities and challenges that are specific to the local context and really require that targeted effort that is specific to local challenges. Next slide. So in addition to partnership coordination, local health departments also serve as a key clinical service provider in their communities as well. This slide shows results from NACCHO's 2019 National Profile of Health Department Survey, which shows that immunizations, both childhood and adult vaccines, are the most common clinical service provided by health departments. So in communities across the United States, local health departments and their immunization programs not only serve as a key strategist around vaccine needs and barriers, but also are an actual vaccine provider and are able to provide those vaccines in a variety of settings. Next slide. And then again, while this slide is from 2017, many of the findings hold true, and a lot of this we're familiar with, again, from our experience over the past 2 years. And that being that limited staff capacity at local health departments and within local immunization programs specifically can make it difficult to really address the myriad of needs and challenges, particularly around vaccine hesitancy and confidence. Vaccine hesitancy and confidence were noted as significant barriers to local immunization efforts, even prior to the COVID-19 pandemic. And of course, we know while things are very different now than they were 2 years ago, vaccine hesitancy and confidence are still a challenge. Next slide. And then in a more recent survey, this one is from 2020, it demonstrates the impact of the pandemic on local health department infrastructure as well. So I really encourage everyone on the call to, if you're interested, review the full report for more information. But want to note here that throughout the pandemic response, local health departments have really relied on community partnerships to meet the shifting needs around vaccine access and vaccine education, among other public health efforts. So these partnerships will really be critical as we continue towards building resilient communities and prepare for existing and current health threats. So now I'll turn it over to my colleague, Victoria.
Katie, next slide, please. And so here at NACCHO, we have two communication channels that are sources for updates and information on local public health. They are known as NACCHO Voice and the Essential Elements of Local Public Health. We use these platforms to provide updates, recommendations, information on upcoming webinars, funding opportunities, and additional public health topics. We've listed two recent examples of blog posts developed within these communication channels. One relates to the National Public Health Week and the first day's theme of racism being a public health issue. And this blog post highlights how NACCHO is supporting LHDs to achieve equity among racial and ethnic groups. We also have pointed out here the second is a call to action regarding RSV and new RSV resources that are available. You can access either of these platforms through our website, and you can filter by public health topic areas of interest. So we definitely encourage you all to check that out if you are interested in learning more. Next slide, please. And this slide is just to let you all know that we do have an LHD directory available on our website, which is linked here. And I know the slides will be available after the webinar. And it's interactive, so you're able to select your state, and what will come up are the contacts that we have available within your area for the LHDs within that jurisdiction. So that is also a resource that is available to you all as well. Next slide, please. And now to transition to the topic area of interest for today's webinar, I will now discuss the benefits of LHDs and CBOs partnering to further enhance health efforts and strategies in communities. And so the benefits of such a partnership include improved access to health services such as immunizations among populations not historically engaged with the health department. It also includes tailored strategies to improve outreach and education, alignment and coordination of local efforts, and most importantly, it shifts power towards community members by further leveraging their voices to ensure services reflect their needs. Next slide, please. And so now I will provide some examples of successful partnerships, which include the Shots at the Shop initiative. And so this initiative is a White House-backed effort from the University of Maryland's Maryland Center for Health Equity, the Black Coalition Against COVID, NACCHO, and the beauty and personal care brand Shea Moisture. And it is to recruit and select Black-owned barbershops and hair salons nationwide. And through this partnership, the barbershops and hair salons promote informed decision-making as a means to increase COVID-19 vaccinations. And they provide the COVID vaccine materials and locations of vaccination clinical sites in their shops. And some also become vaccination site locations. Another example is a faith-based partnership. So Ingham County Health Department in Michigan partnered with a church that served their Latino population to host a pop-up clinic. And through this partnership, they had interpreters and other Spanish-speaking volunteers to assist their efforts. And outreach materials were promoted by the clinic, and they were developed by the church and the health department, and they included both logos. And furthermore, the church staff and volunteers conducted outreach to the population of interest to assure them about the variety of forms of ID that could be accepted at the event, and that the vaccine registry database that is used is only available to health professionals and not accessible to law enforcement. This health department also partnered with faith-based organizations within their Black community to host vaccination clinics, and learned that many of those who attended stated that the vouching of the safety for the vaccine by their pastor and other church members is a significant reason why they chose to get vaccinated themselves. And the final example I will discuss with partnering with the CBO is to access homebound populations. So Nevada County Public Health Department utilized information from their Meals on Wheels and Senior Firewood program, as well as other targeted resources to locate individuals who were homebound in their jurisdiction. And with this information, they conducted home visits to provide the COVID-19 vaccine. And additionally, while during these visits, they were able to make referrals for other public health needs, thus providing additional linkages to care. So those are just some other examples of successful partnerships. And now I will pass it back to Leandra so we can get into our current examples we have on the call today.
Awesome. Thank you so much, Katie and Victoria, for all of your great input. I'll remind everyone that you can submit questions for the presenters in the Q&A feature, and we'll address them at the end of the webinar today. But next, we'll transition to Lily Hall at the South Carolina DHEC Upstate.
Good afternoon, everyone, and thank you for having me. I'll be brief before you, but I would love to share a little bit more information about our county, Cherokee, as part of the PAVE grant and the learning communities, as well as share a little bit about what we have been doing with community-based organizations. Next slide. So let me start just by telling you a little bit about Cherokee County. It is a rural county bordering North Carolina. A major interstate, which is I-85 or Interstate 85, cuts across the upper portion of the county and fuels the slow economy. It has a population of a little over 56,000, and the poverty level is about 15%. It is also home to about 141 people per square mile and one college, Limestone College. Most of the activities center around the town seat at the heart of the county, which is Gaffney. It was founded in 1897 as a fun fact and was named for the Cherokee people who historically occupied this area prior to the European encounter. You will also note that the southern part of the county does not have a lot of access to resources just by viewing. And it depends on resources from neighboring counties of Spartanburg, Union, and York, from which this county was formed. Next slide. As another fun fact, and this may be known by some of you who, if you visited the area before, when you come to the area, you tend to see this big peach water tower. It's very hard to miss if you're riding along the interstate. It is in Gaffney, Cherokee County is also home to the annual South Carolina Peach Festival, which we're looking forward to, hoping that they would bring it back this year. Plans are underway, so we're looking forward to that. You can also see where Cherokee is in proximity of the state and of our public health region, which is the seafoam green at the top left-hand corner of the map. Next slide. Health departments have known for many years that we cannot do public health alone and expect to do it well. We must develop our communities and partnerships to support our many efforts. COVID-19 exacerbated this understanding with non-traditional partners who reached out to us to learn how and where they can help with our response. We leveraged those opportunities to develop new relationships and further expand our current relationships. One of our main partnerships in Cherokee was with a group by the name of No2. It's a local nonprofit community health organization, and it has a capstone of volunteers, a group called the Neighborhood Ambassadors, who became a subsidiary of the No2 Coalition. Their goal was to work and to help assess the needs in the county and impact those needs. When the COVID emergency started, they wanted to know where they could help. This group is led by Carol McFadden, who is a former educator there in Cherokee County. Next slide. As a great segue to that, leveraging current and developing new partnerships led to some bold gestures by some of our partners. We dubbed them as COVAX champions. At the height of the COVID-19 emergency response, politics played a large role in the temperament of the public regarding testing and vaccinations. Our agency was continuing to follow the recommendations of the CDC to roll out the vaccination in phases. Cherokee County was not exempt from these same attitudes and experiences, yet at the risk of losing their great reputations, 3 very brave members of the community stepped up to offer their voice for increasing vaccine uptake in the county. Clockwise, you see Carol McFadden, who I just noted as the fearless leader of the Neighborhood Ambassadors. She shared that she was vaccinated to encourage others to do the same. Dr. Charles Stroop also volunteered to support our efforts as a trusted voice of the medical community. And then you have Councilwoman Norris, who lost her mother to COVID and wanted to share her story so that others of all races and ages would not have to experience her grief. Next slide. This is a picture of some of the neighborhood ambassadors. There are more than 100 volunteers that participate in this particular group. That's a subgroup of NACCHO, led by Ms. McFadden, who is there in your center. But when we shared with NACCHO that we had a lot of work going on in Cherokee, the ambassadors wanted to step up and figure out how and where they could help and impact the work that we were doing in some way. So we set up a training, a just-in-time training with this group and shared with them what needed to, what we felt needed to happen in the community. We also let them assess some of the needs as well. And they were able to be a vital group that helped us to engage the communities of all ages, races, and cultures. Next slide. So speaking a little bit about the COVAX Champion Initiative, it was not only identifying those community champions like the ones I just mentioned on the previous slide and using their voice, it was also a process to identify, educate, and promote COVID vaccinations to hesitant and misinformed populations. Those three on the previous slide were part of op-ed series in the local print news media, the Gaffney Ledger, where they shared their stories and messages to encourage others to get vaccinated. This series was part of the pre-vaccination education activities of the COVAX Champion process. When a vaccine clinic was being scheduled, health educators and the community health workers connected with the site coordinators for those clinics, and they scheduled pre-education and information sessions, hoping to reduce any barriers, meaning any doubts, hesitations, and misinformation to those folk getting vaccinated. Incentives were not always available, but when they were provided by the community partners, another great incentive. Next slide. Our health department reaped many successes, and I'll just name a few here. As COVID-19 vaccination appointments began to roll out, many Cherokee County seniors found the sign-up process, as across the nation, I'm pretty sure I'm speaking for several, it was cumbersome and difficult. Community advocates also noticed that members of the Black community were experiencing concerns and hesitations about the COVID-19 vaccine. While DHEC's new centralized online system was improving the process, community members, Dr. Carol McFadden and Christina Cody, began mobilizing their networks to identify seniors in need of assistance. Acting under the COVAX Champion process, the neighborhood ambassadors reached a broad base of community, mostly in the low-income areas of risk. They built relationships in the community, helping where needed and inspiring adults, young adults, and children. Working alongside the neighborhood ambassadors, Dr. McFadden was the trusted voice in that community, carrying messages forward about the vaccines and vaccine safety. By publicizing the shots she received, there had been a significant boost in the vaccine acceptance within her community. Although the overall percent of vaccine uptake was low in Cherokee, it was very high in the Black and African-American population. Speaking of the additional person on the screen on the slide, Christina Cody is Cherokee County School District project lead for a student-driven initiative that was designed to affect positive health outcomes through empowerment and action. Also, she is a well-known advocate in the community. She assisted Dr. McFadden in helping folks to the earlier sign-up system, following up to confirm appointment times and ensuring that transportation was in place. The neighborhood ambassadors stood by on hand to help anywhere they were needed. The health department viewed the vaccination process as an opportunity to develop new partnerships and leverage resources and capitalize by providing relevant and timely information and uniting and utilizing community leaders in the necessary public health work that was required. With the help of the neighborhood ambassadors and other partners, we were able to administer more than 6,000 first and second doses between February and December 2021 to those populations. Next slide. So as we all know, success never comes without challenges. Some of the challenges that we encountered was the political climate. We had to stay neutral because most did not want to discuss COVID with anyone from, quote, the government. Limited supply when we did the vaccines in phases. Limited access to rural areas of the county and those limited partners who were reaching out to those areas. The attitudes of the public towards science and the authority of the local, state, and national entities. There were inconsistent messages just because of the many and constant changes. And then of course, misinformation from Dr. Google and the BBBB, the Better Business Being Bureau, was huge at that time. Next slide. So some tips on building some versatile partnerships would be to start now. Take advantage of the pandemic. Is not a good time. You know, we have a hard time when we're in the community talking about utilizing this opportunity, but most people understand, especially if you're in public health, that these are those times where we need to step up. So start now, take advantage of the lessons learned through the pandemic and start focusing on those. But the biggest part of that is trust building. Identify your champions and leaders first and let them be a part of the process early on to motivate the others in the community. Those are usually your gatekeepers. Meet with them often for training and listening sessions so that you can help to remove any misinformation. But at the same time, you're helping to build their trust and build rapport. And they'll know to come to the health department as the go-to place because we are the chief health strategists for our communities. Identify their strengths and resources and update that inventory periodically because resources tend to change often. COVID highlighted many health disparities that centered around the social determinants of health. So we should definitely use this opportunity to establish conversations and continue those conversations around how we impact the social determinants of health, because non-traditionally, we have not done so. Building versatile partnerships will assure sustainable partnerships. Focusing on the social determinants of health as a guide will help assess other ways to engage these partners and keep them engaged. Regarding No2, they also sponsor the local Host Bar Coalition, which is the former Eat Smart, Move More Coalition and the local food share program. The health department partners with them in many ways to improve the overall health of Cherokee County. Next and final slide. I hope this presentation gave you some insight into the work that we've done in Cherokee and across our public health region, as well as some ideas that may be piloted in your communities, if not already. And thank you for your time today.
Awesome. Thank you so much, Lily. Last but not least, we'll transition over to Jenna O with Washington County, Oregon.
Hi, everyone. Thanks for having me today. I serve as Community Partnerships Coordinator for Washington County. In my role, I am embedded in our vaccine team and also act as a liaison for community organizations wanting to partner with us. Personally, I am passionate about building partnerships for health equity. Next slide. So to start off, I wanted to share some context in which our partnerships started. Washington County is located in Oregon and is the second most populous one in our state. We're adjacent to Multnomah County, which includes Portland, some of you might be more familiar with. Washington County, with the total population of about 600,000 folks, is a home to quite multi-ethnic population. 25% of people in our county speak another language other than English. And just about 1 out of 5 persons born outside were born outside the US. So just some indicators of how diverse our county is. And the pictures on the right shows our geography that includes both urban and rural areas. Next slide. And the diversity of our county is an important context, and one of the reasons it was important for us to expand our partnerships. As you can see on this chart, non-white and Hispanic community take up a little more than a third of our population. Next slide. And this shows a little bit more of the diversity in our county. Many folks in our county have diverse language and cultural connections, which was important for us to consider in our public health communication and outreach strategies so that we can develop interventions that recognize and resonate with multiple ethnic and cultural groups. Next slide. Also, young folks, youth make up a big portion of our population, and they're an important demographic group we consider in our strategies. Next slide. With that context, when COVID-19 arrived in our county, we were seeing the infection rate was 3 times higher in the Hispanic population. About half of the people who tested positive were Hispanic, when they made up much less, 16% of our county. The inequities leading to higher infection rates, those social economic inequities experienced by Hispanic community, as well as other communities of color and essential workers, made it all the more important for us to use equity lens and develop interventions that were culturally appropriate through partnerships with community organizations. Next slide. And after COVID vaccines became available, we were still seeing disparities in our vaccination. Building trust and relationships were key to increasing vaccine uptake across our community. So we went ahead and contracted with 24 organizations, community organizations, and provided more than $2.5 million to these organizations to support vaccine and other pandemic recovery activities. Our CBO partners were local organizations, local to our county or local to our state, and they had a strong network and language skills to connect with the community. And these partnerships essentially helped us to provide timely updates and information about vaccines in total 33 languages, and provided culturally specific outreach for the Latinx and the Black and the Asian Pacific Islander communities. And community organizations also co-led with us a number of vaccine clinics in various community spaces. So for example, we set up vaccine clinics at community organizations, facilities, because they were already serving as a safe, trusted space for community members to gather and seek resources. And to support this collaboration, community partnerships coordinators like myself provided technical assistance and coordination support. And additionally, for us, it was important that our community-based organization partners can go beyond just providing services on our behalf, but they can also shape our work together. So we invited community organizations to COVID-19 Racial Equity Advisory Group that met twice a month, and they were able to share feedback on our work with our county program officers and supervisors. Next slide. One example is our partnership with Vienna Star. Vienna Star is a nonprofit organization with 12 affordable housing properties, housing more than 2,500 residents. The organization had a strong cultural connection to the Latinx community with their mission to provide quality housing to farm workers and their families to address substandard living conditions in migrant camps. And 95% majority of the families they serve are immigrants and farm workers. So Vienna Star's connection and expertise in serving the Latinx community aligned really well with our county's need to reach this population. Once our contract was established, Vienna Star was able to hire staff to work with us to focus on outreach and collaboration for vaccination. And since our partnership began, Vienna Star hosted 14 clinics at their housing facilities and brought more than 500 vaccines to the community. And during this partnership, we also learned about the barriers experienced in the community for accessing flu shots. So we were able to host a free flu shot clinic at Vienna Star's housing site as well. And through this process, we had some lessons learned as well. We learned from our healthcare system partners that they need to anticipate and start planning flu shot clinics early, like in July or August, whereas community organizations were more likely to ask for this in September or October. So these lessons will help us set up successful partnerships for the next coming flu season. And the next slide. So Vienna Star being one of our partnership examples, our partnerships with community organizations actually took slightly different forms, depending on which ethnic or cultural group we were reaching. So for example, some organizations used broad-reaching strategies like radio ads and presentations, while others used more individual outreach calls and visits. Individual visits to bring education to their community. Living Islands, you can see their work on this photo, is one of our organization's partners that we partner with. They combined a vaccine event and culturally specific food drive to reach Pacific Islanders. While food was not always part of our vaccine events, our county tried to support CBO partners in providing resources that would help build trust and bring communities together. And this was a huge success for our vaccine work. Through our partnerships with our community organization partners, our partners hosted 108 COVID vaccine clinics so far. And total, they were able to provide more than 8,500 doses to the community collectively. Next slide. In fact, our partnerships have been instrumental in raising our COVID vaccine rates. Currently in our county, 82% of all people over age 18 have been vaccinated, and about half of them have received a booster. Next slide. And we still have more work to do. As you can see on this chart, our vaccination rates still vary by race. Rates for the Latinx and Hispanic and the Black and African communities are steadily increasing, but still have lower rates, especially for boosters, where only a third of Hispanic or Latinx community has been boosted. Next slide. Our vaccine coverage also vary by age groups. For children aged 5 to 14, it's increasing slowly, but still lower than where it would like to be. And then the next slide. So for the remaining work and future collaboration, we hope to continue partnering with our community organization partners to bring, in order to bring culturally responsive health education. Whenever possible, we want to increase resources available to our community partners by connecting them with healthcare system organizations. For example, more and more, we're connecting community organizations with local healthcare system organizations also wanting to partner to host events for COVID vaccines, as well as other health education on various topics such as hypertension, diabetes, and cancer preventions. Those connections will not only increase our access for COVID vaccines, but also other health resources, for example, around childhood vaccination and care for other chronic diseases that may have been postponed during the pandemic. Community health workers were also an important workforce for vaccine promotion. So we are working on expanding the network and capacity and providing funding to CBOs, our community organizations, to support this workforce. So in conclusion, we also have learned some lessons from this year, which will be important for our work, our future work. And community organizations will continue to be our key partners for building trust and promoting vaccines. And that concludes my presentation.
Great. Thank you so much, Jenna. And again, thank you to all of our wonderful presenters today. You all provided great insight into some of your work in talking about these partnerships, which are so important to vaccine equity work, but public health work in general. So I really appreciate it. And I know we're running short on time. I didn't see any questions in the Q&A. So one question that I'll propose for our speakers is kind of a round robin. What's one piece of advice for an organization who has not previously engaged with their local health department, but want to begin initial conversations? What's that one piece of advice that you would give to an organization?
And I was going to say, I can start. I would say the main thing is that first tip that I put up was to engage now, to do assessments and have those meetings, find out who those partners were that you worked with through the pandemic, those who reached out to you, those who show an interest in partnering in some way, even if it's not necessarily around vaccines. Generally, a conversation with them will turn up, that there's an opportunity there that you can partner with them. And as Ms. O just noted, really working with, you reaching out to our other professionals, the other, piece of the puzzle for public health. And that egg diagram that we shared early on really shows you that as the center, the health departments as the center, the chief health strategist, we literally touch every one of those different, people and agencies in that diagram. And we still call it the egg diagram, but starting early, starting now, while you have that opportunity, you have that interest, to really talk to them and just have those, one-on-one discussions with these agencies to learn about them and then engage them and let them know that this is kind of where we are now. And we want to be prepared for, the next pandemic or the next emergency.
Thanks, Lily. And I did see in your presentation, that was a great list of tips. So thank you for adding on to that.
Yeah, so I would say for health departments, I think, really connecting with all community organizations that might be interested in partnering. And also not, I think for us, it's been really helpful to partner with very local organizations, those hyper local organizations that might be smaller, super grassroots. They might be volunteer led. Even those organizations that might not be always at the table or looking, reaching out. those have been great opportunities for partnerships, because those folks are have a lot of trust and connections. Those organic connections are great ways to build trust with the community. And then for, I think, community-based organization partners, as Lily mentioned, you know, don't be afraid to reach out to us. Just start reaching out. A lot of us are really eager to connect with you. And if it's just meet and greet and getting to know folks, and what I come across a lot is our community organizations. They let us know, oh, actually, we didn't know, our community folks don't know this is available. We don't know if this vaccine clinic is for them, it's for free, and things like that. So, and that also goes for other health education as well. Those sharing, exchanging and sharing those resources can really help to build trust and relationships. Yeah, it's just great to get connected.
And I kind of jumped back in. I hope it's okay, because I wanted to add on to what Ms. Jenna just mentioned about trust, because that is one of the things that we have, we still struggle with, within the counties that we work in. And it's very important. So one of the things that we have been focusing on is how to build trust. What are some of those things that you can do to build trust? So we started, it's not necessarily post-COVID, but it was in the midst of COVID as we were demobilizing and starting to go into the demobilization, is that we started doing what's called listening sessions. Really going to them, not really having an agenda to establish that meeting. It was that we just want to meet and greet. And Jenna, you just said it perfectly. We just want to sit down, just have a conversation, whether it's over coffee, whether it's over, lunch or whatever it may be, and just want to hear what you feel the needs are, instead of going in with what we consider as the needs that we find or we have assessed. We should always open those doors for them to tell us what they're feeling. And we call those felt needs. And once we address the felt needs, and when we really know what they're feeling, and we're doing that with data walks, we're doing those as well. Some of you may have heard of data walks. We just did one this morning in Oconee County, where we invite different sectors of the society into this particular meeting to learn about what data is available, what that data means. And we even introduced the social determinants of health to them so they can understand how they play together and how important that is. That's all a part of building trust. Very important to figure out those ways to build trust.
Thank you, Lily. I appreciate you jumping back in. That was totally fine to add on to what was said. Victoria, Katie, I'll give the last word over to you all if you wanted to add anything here as far as starting those initial conversations.
Yeah, the only thing I would add, in addition to, I think Lily and Jenna, hit a lot of those key points, I would just also add to have a little bit of patience, but also persistence. Just knowing, how much health departments have on their plate, but also community-based organizations as well. We've all been asked to do a lot over the last 2 years. So just recognizing that as well, and giving everyone a little bit of grace, knowing that we're in a new phase of the pandemic, but still very much sort of, recovering from what the last couple of years have been. So to be patient with one another, but also to, those relationships will come when they come, and to just be persistent in knowing what you hope to get out of that partnership, and continue, knocking on doors, making phone calls, and really advocating on behalf of that partnership.
Awesome. Thank you so much. That was a wonderful way to wrap us up, Katie. I really appreciate it. So thank you again to all of our great presenters today, especially to our NACCHO colleagues. They were instrumental in getting Jenna and Lily on board, and doing a lot of coordinating for this webinar. So I appreciate it. Before you all hop off, I know we're a little over time, but before you all leave, I would love for you to take just a satisfaction poll about the event today. It'll help to inform future learning community events. And while you're doing the poll, I'll just highlight some upcoming events from the learning community. On May 19th, we'll be hosting an Access Expert session on best practices for virtual event planning. On May 26th and June 9th, there will be workshops on community-led vaccination clinics for underserved community members. And for calendar events, you can always visit the Learning Community virtual platform at vaccineequity.urban.org. My colleague has dropped in those registration links to the events that I mentioned, and you'll also have access to these slides after the webinar, so you'll have the links there as well. But thank you all again. I hope you all enjoy the rest of your day and that you found this content useful and relevant to your work. Take care, everyone.